The Curtis National Hand Center at MedStar Union Memorial Hospital is leading the nation and much of the world in innovative practices and techniques. But it's a recent microsurgery on a very rare disease that is changing the lives of many young people, especially young men, including one right here in Baltimore. Take a look.
So, in fact, this patient right here.
Zach Zalewski was just 28 years old when a sore wrist started to bother him a lot.
It lingered and it grew and it kind of progressively got a little worse. And it never got better, so I just decided to go get it checked out. And the first thing they said was pretty much right away. They knew what it was because you could tell from the x-ray there's a pretty glaring spot where the bone is dying and kind of falling apart.
He was diagnosed with a rare condition known as Kienbock's disease,
which means that the blood supply to the lunate, which was one of the bones in your wrist, gets cut off, and when there's no blood supply to the bone can't survive anymore. When they told me I had Kienbock's, I was not aware. I had never heard of Kienbock's disease or even the term avascular necrosis.
That's because it was extremely rare. It was treatable, but not by methods that Zach found appealing.
The first recommended option that I had was to actually remove 3 bones from your wrist.
That would have alleviated some of the pain, but would have left him with limited mobility.
And so I went for a second opinion.
That second option presented had doctors trying to save the bone, but Zach's bone had deteriorated too much for that to happen. Luckily, there was a third option that turned out to be the best of all.
Rather than removing the bones, we give young patients the ability to maintain the normal structures in their wrist.
Living in Baltimore put him right in the very city where Dr. James Higgins was developing and utilizing a new microsurgery for Kienbock's patients at Curtis National Hand Center at MedStar Union Memorial Hospital. It used a bone from the knee to replace the bone in his wrist, the first place to do it in the nation.
In order to transfer that bone, we can't just go in there and take the piece of bone and cartilage out and insert it into your wrist and say, that's a good day's work, we're done. The problem with the Kienbock's disease is that the lunate doesn't have good blood supply. So we have to insert a piece of bone that has its blood supply that comes with it. Fortunately, this piece of bone, which is demonstrated here in the diagram, is conveniently located very close to a blood vessel that gives it perfusion, and this is an expendable blood vessel. As far as that bone is concerned, it probably thinks it's still in the knee, but it is perfused, and now the blood supply enables it to heal to the remaining structures of the wrist, and it restores normal anatomy.
Zach soon became only the 5th person operated on with this new procedure. Years later, he says he has his life back.
This was really the only option for me that would actually have me have use of my hand and wrist again.
The surgery for Kienbock's also led to his application for another common wrist injury. Same technique, just another problem solved.
And them testifying about their experience and what it's done for them has been really probably the most important thing in the growth of this operation, which is sort of revolutionizing the treatment of these 2 problems.
Dr. Higgins says seeing the progress of patients like Zach is what keeps him and the rest of the staff at Curtis National Hand Center excited and encouraged about all that is happening here and what more is to come.
To be on the sort of pioneering curve of something that you believe in and that is having impact on people's lives is a great experience. I think that's really what all doctors want.
For more information on the Curtis National Hand Center at MedStar Union Memorial Hospital or this surgery in particular, you can go to medstarunionmemorial.org. We'll be right back with more Midday Maryland right after this. Stay tuned.